Dr. Stewart, it usually takes a few minutes because we have folks who are ending their meetings and things. So that's why we wait a few minutes to get started.
No problem.
Okay, I think we can start. Welcome back, everyone, to the Autism and Adulthood Seminar Series. I'm Dr. Eleonora Paolizzi, and I'm chairing this seminar with Dr. Claire McGrath. It's wonderful to see many names coming back and many new names with us today. And Claire, if you want to introduce yourself.
Absolutely. Thank you. So, yes, again, welcome everyone. We're so pleased that you're here. As a reminder, Bancroft and the Drexel Autism Institute have created this series to reflect our partnership and interest in integrating research and clinical care to improve the quality of life for autistic individuals. So, we're just so grateful that Dr. Stewart is joining us today and that we have all of you with us again. As a reminder, the session is being recorded and it will be shared afterward through the Autism Institute social channel. Please feel free to share questions and comments through the chat during the seminar. We will have time for discussion at the end. And also, just as a reminder, please mute your microphones while you're attending the seminar. So thank you.
So today it's our honor to have with us Dr. Gavin Stewart. He's a postdoctoral fellow at the King's College London, and he's the co-leader of the Respect Lab with Professor Francesca Pet. I had a pleasure of meeting Gavin through the special interest group on midlife and older age, which he coordinates. And I'm truly grateful and honored to have him today with us, as he's one of the leading voice in autism and adulthood research. So, Gavin, the floor is yours.
Great, thank you so much. Let me
Yeah,
share my screen.
Damas.
Can you see my slides?
Yes.
Perfect. Okay, so it's great to be here and thank you so much for this invitation. I'm Gavin Stewart and I'm a research fellow at King's College London in the UK. Today I'll be talking to you about the cognitive, health, and social experiences of autistic people in midlife and old age. Before I begin, I want to say that I'm not a clinician, I'm an academic researcher. However, my research does have a strong clinical focus, and I work with many clinical colleagues to conduct my research. And I'll also be sharing my slides with the organizational team, which I'm sure will be shared after this session. So I'll start with a brief introduction to autism, and then I'll move on to talk about autism in the context of aging. Then I'll discuss a range of different studies that focus on my group's research on cognition, health, transition periods, social experiences of autistic people in midlife and old age. And I'll also be talking about periods of crisis, which might be a sensitive topic for some here. I will flag before I move on to this section, though, just in case you do want to step away. And then I'll wrap up by giving a few sort of conclusions and considerations before we move on to the Q&A and discussion part of the session. So let's begin with the background. So the big question, what is autism? Within a diagnostic context, autism is a set of highly heritable, lifelong, heterogeneous neurodevelopmental conditions. And the autism spectrum is characterized by differences in social communication and rigid and repetitive behaviors and interests. And these often present as differences, sometimes difficulties, in initiating and sustaining reciprocal social interactions, including taking the perspective of others in social situations, and as inflexibility in routines and having sort of narrow or intense interests. There are other features commonly found to be associated with autism too. For example, intellectual disability is quite common, affecting approximately 1 in 3 autistic people. And while not part of the diagnostic criteria, autistic people often have poor mental health. They experience a lot of stigma. They have different and more variable support needs than non-autistic people. And many autistic people also encounter barriers to succeeding in education and employment. So, in terms of the prevalence of autism, current estimates suggest that approximately 1 to 3% of the population are autistic. And it's believed that these rates are comparable across the lifespan. We also see autism being more commonly diagnosed in men and boys than women and girls, with a 2-to-1 ratio. So, as a researcher based in the UK, I often like to discuss autism in a UK context. However, we do see very similar patterns in populations across the world, including in Europe, North America, and Asia. So, based on the 2023 census, there are 68 million people in the UK, with around half being over the age of 40. Another point to consider is that the UK, like many other countries in the world, has an aging population. And we're set to see a large increase in the number of people over the age of 65 in the coming years. So understanding the needs of older people is very important. So putting all of this together, this means that there are upwards of 680,000 autistic people in the UK, and approximately half of these people will be over the age of 40. However, we see far lower rates of diagnosis than 1% in people over the age of 40. And this points to a big issue of underdiagnosis. I recently reanalyzed UK healthcare record data, and I was able to estimate that over 90% of autistic people over the age of 40 will actually be undiagnosed or misdiagnosed with another condition. And you might be wondering why we see such high rates of underdiagnosis with increasing age. And the answer is somewhat simple. While autism is not a new condition, our understanding of what autism is and the current diagnostic criteria are very new. The diagnostic criteria we use today has greatly evolved since the initial clinical descriptions in the 1920s through to the 1940s, and even up to the early 2000s. This means that those diagnosed today under the current diagnostic criteria look very different to those who were first diagnosed based on the early descriptions. And these early descriptions were often very narrow, which means that many autistic people were overlooked. However, many of these autistic people are increasingly being recognized later in life under the more recent diagnostic criteria that is much broader. And the changes to diagnostic criteria and the wider issues of underdiagnosis are also reflected in research about middle-aged and older autistic people. I conducted a review in 2021, and despite autism and aging research having a reassuring increase over the past decade or so, we found that less than 1% of all indexed autism research has focused on midlife and older age. And this lack of research on aging and autism has had a wide rippling effect into clinical practice too, as historically clinicians haven't been trained and equipped with the understanding of autism in older age. So now that we're all on the same page about autism and aging, I'll move on to talk about a range of studies exploring cognition, health, transition periods, social experiences, and periods of crisis. So to start, I'll talk a bit about cognitive profiles. And understanding cognitive profiles can be very important as cognitive abilities have broad-reaching implications, including whether a person is able to live independently. While I wasn't involved in the study I'm about to talk about, I think it provides some important context for what my work has built upon. So Professor Hilde Geertz, who is a clinical neuropsychologist in Amsterdam, has led much of the early work in aging and autism. In this first study on cognition in older autistic people, Hilde found subtle cross-sectional differences in cognitive profiles, with the autistic participants having poor performance scores across several domains of cognition when compared to a matched non-autistic comparison group. And cognitive changes with age are a natural part of aging. So to further explore this in autistic populations, Hilde hypothesized that we might find three different longitudinal trajectories of age-related change in cognition for autistic people. So the first is a parallel aging trajectory, where autistic people, represented here by the red line, will have similar age-related change to the general population, represented by the blue line. The plot of this trajectory takes into account that autistic people may have slightly lower performance scores than the general population. Thus, the red line is slightly lower than the blue. The second is a safeguarded aging trajectory, where where being autistic may confer a level of protection against age-related change. And this could be due to autistic people developing compensatory strategies that may help them preserve their cognitive abilities as they age. And finally, a double jeopardy situation, where being autistic compounds with age-related change, resulting in a more rapid cognitive aging. And this is perhaps the most concerning of the three trajectories. So Hilda's group set out to test these trajectories, with this work being led by Caroline Tornvliet. And using data collected from their clinic, they recruited 128 autistic people aged 25 to 85 and tracked them over a 3.5-year period. They found that autistic people consistently had lower cognitive performance scores compared to the matched non-autistic comparison group. But importantly, they found that age-related change across several cognitive domains were similar in both groups. So Caroline and Hilda provided some of the first evidence that autistic people may have a parallel aging trajectory in their cognitive abilities, which is quite reassuring. And these findings have also been partly replicated in very large samples in the general population in my own research. I conducted a study several years ago now, which used data from over 22,000 people aged 50 to 80. We used a dimensional approach in this study, so looking at autistic traits, and we found that 1% met cutoff on a very stringent autistic traits measure. And like Hilda and Caroline's findings, our sample of people with high autistic traits had subtle differences in their cognitive profiles when compared to those with low autistic traits, with the high autistic traits group having these sort of lower scores across several different domains. We've recently built on this study, which was led by one of my former students, Saloni Guy. Saloni 7-year period in over 12,000 participants over the age of 50. And again, we used a dimensional traits approach with around 1% meeting cutoff for high autistic traits. We found that the high autistic traits group had very similar age-related change to those with low autistic traits. So this provided further evidence of the parallel aging hypothesis, which again is really reassuring for autistic people that they're not likely to experience rapid cognitive aging. However, in some of Caroline's most recent work, she did find that around 20% of autistic people had a deviant cognitive profile with lower than expected cognitive performance. So in this figure, there are a broad range of cognitive measures listed by the letters along the x-axis, while deviation from average performance is on the y-axis. The majority of the autistic group fall into this blue line. However, around 20% have a cognitive profile that deviates from the majority being represented by the orange line. So given that around 20% of autistic people in the sample had below average performance across various domains compared to other autistic people, this may indicate an old age cognitive profile emerging at a younger age for some. And by this, we mean that as people age and their cognitive abilities change, red flags and cause for concern for cognitive decline and dementia may present at a younger age than what would be expected in the general population. And we often find that middle-aged and older autistic people have concerns about their cognitive decline. Claire Klein, who's based in the USA, found that around 30% of autistic people in their study endorsed enough red flags for cognitive decline to be above cutoff on a common dementia screener. However, interestingly, Claire didn't find a strong age association with cognitive decline scores, which maps into Caroline and Hilda's concerns about autistic people having this old age cognitive profiles at a younger age. And we've also been able to find similar results in my own group's work using our large general population sample with a subgroup having high autistic traits. Okay, next I'll move on to talk a bit about health profiles. So health and healthcare access are very important for people's well-being. And young autistic people are often found to have higher rates of physical and mental health conditions compared to non-autistic comparisons. And as people get older, health can change. So understanding the health profile of middle-aged and older autistic people is of great importance. So the first study that I'll be talking about in this section is led by Brittany Hand in the USA. And Brittany used American healthcare data from Medicaid to examine the rates of different physical and mental health conditions in older autistic adults. While I also wasn't involved in this specific study, I think it provides some important context for what my work is sort of built upon, similar to Hilda's work. So in this study, they found that older autistic people had higher rates of a range of common conditions, including being almost 6 times more likely to have a mood disorder, 3 times more likely to have gastrointestinal conditions. They also found higher rates of most age-related conditions as well, including being 6 times more likely to have Parkinson's disease, 8 times more likely to have a cognitive disorder, 4 times more likely to have osteoporosis, and nearly 2 times more likely to have arthritis. They also found that people were around 2 times more likely to have heart disease as well. So these are quite concerning conditions. And we've been able to broadly replicate these findings as well in some of my own group's work. So focusing on people in midlife and older age with high autistic traits. And we found that our high autistic trait group were 3 to 4 times more likely to have a diagnosis of depression anxiety than our low trait comparison group. And we also found that cognitive conditions and arthritis were common as well. We didn't find some of the other conditions though, but that might be more of a sort of a sampling related issue, as this is a sort of a convenience-based sample rather than sort of healthcare records. One thing though that we did find in the current study is that people with high autistic traits were more likely to report having multiple mental health diagnoses, with almost 20% of the sample having 3 or more mental health conditions. So this points towards autistic people having more complex health needs than the general population and requiring continued care from their general practitioners and specialist older adult services as they age. I think it's worth stressing here that being autistic may confer a range of sort of biopsychosocial risk factors for health conditions. For example, some of these conditions may share genetic liability with autism, but also many of these conditions are linked to lifestyle and socioeconomic factors as well. And we really need to have more longitudinal research that tracks people across the lifespan to truly understand the contributions of these different factors on the health profiles that we're finding. Okay, so next I'll speak a bit about a study building on some of our building on this sort of diagnosis work, moving over to symptoms. And one of my former students, Effie Eshtu at UCL, explored how symptoms of poor mental health change across a 7-year period. So here we're focusing on generalized anxiety symptoms, which is one of the most common diagnoses that autistic people often have. And Effie used growth mixture modeling on over 20,000 participants' data and found that there were 3 primary trajectories of anxiety symptoms. While the majority of the participants were in the purple and the green lines, so representing sort of low anxiety symptoms, those with high autistic traits were 12 times more likely to be in this orange trajectory line, which is characterized by increasing anxiety into a range that is of clinical concern. So this adds to the broader picture that older autistic people may be at greater risk of persistent mental health concerns as they age, which could result in them accessing older adult mental health services for support. Next, I want to talk about other health experiences, including those that are often seen as sort of correlates of poor mental health. One area that a lot of autistic people struggle with is sleep. And also, as people get older, they often begin to encounter more sleep problems as well. So it's a particularly important topic in aging and autism. This work was led by 2 of my former students, Sophie Roper and Andrea Barbinta. They explored sleep problems and mental health in a sample of autistic adults in midlife and older age. And this sample includes 276 autistic people aged 40 to 91 being compared with a matched non-autistic control group. Sophie and Andrea found that sleep difficulties are somewhat common, and that about half of the full sample had some difficulties with one or more aspects of sleep. However, we found that the autistic participants are far more likely to report moderate or severe sleep problems, and this included problems in overall sleep quality, how long it takes for people to fall asleep, how long they manage to stay asleep for, how efficient their sleep time is, how many times they wake up each night, needing to use sleep remedies, and also having daytime tiredness and dysfunction. And these findings broadly replicate some of my previous work using high autistic trait samples. Sophie and Andrea also examined the associations between poor sleep and mental health symptoms, and they found that sleep problems were correlated with poor mental health symptoms with a particularly strong association with anxiety. And this perhaps makes a lot of practical sense. People who are often quite anxious are likely to struggle with relaxing while trying to sleep. It's also important to note that poor sleep can often be a symptom of poor mental health as well. So there is a bidirectional relationship between the two. But sleep problems can often be overlooked when addressing mental health. So considering whether there are practical improvements that can be made to sleep could be beneficial for supporting autistic people with their mental health as they age. We have also explored the influence of sensory problems and their impact on mental health. As previously mentioned, many autistic people experience differences in their sensory processing, and this can have a big impact on their well-being and functioning. In this project, which was led by Yixin Chen at UCL and co-produced as well with Christine Jenkins, who is a community-based researcher in Canada, we found that there was a strong positive association between the frequency of experiencing sensory problems and symptoms of poor mental health in our sample of autistic adults in midlife and older age. In the study, participants were also able to provide open text responses to contextualize their experiences, and they reported that noise was a particularly impactful sensory exposure, and many people would avoid certain locations if they knew it would be too overcrowded and noisy. So I think the findings of the study really highlight how the spaces that we occupy can really have an influence on people, especially if they have sensory sensitivities and they're finding that their world is sort of closing down and becoming smaller because they're not able to access the communities that they live in. Okay, so I'll move on to talk a bit about some life experiences and some transition periods as well. So to start, I want to talk about traumatic life experiences. Um, Interpersonal trauma is something that seems to be particularly impactful on autistic people, and they also appear to be particularly susceptible to experiencing it throughout childhood and younger adulthood as well. So in this study led by Ellen McAdams, we explored experiences of interpersonal trauma in a sample of almost 500 autistic adults in midlife and older age, and we compared them to a matched control group of non-autistic people. Ellen found that middle-aged and older autistic people experience high rates of a range of abuse and neglect experienced throughout childhood and adulthood. And some of the rates are particularly concerning. Emotional abuse and neglect were particularly high, with over 60% of our autistic participants reporting that they were emotionally neglected as children. We also find high rates of sexual abuse as well, and this was a particularly high concern for autistic women. And like many of our other studies, we find that this replicates our previous high trait work, where we also found very high rates of these interpersonal traumas. So taken together, these findings add to the increasing call for trauma-informed care and support when working with autistic people. And I think these trauma findings underscore that many autistic people will have experienced negative life experiences and they'll need adapted help and support that is considerate to their previous experiences when they are approaching services for addressing their mental health concerns. Next, thinking a bit about transition periods. Another process that people assigned female at birth will experience is menopause. Menopause is an important transition where people assigned female at birth experience changes in their reproductive functioning, leading to variability and lowering of hormone levels. We find that people in the general population also often have difficulties with the menopausal transition, with around 25% or so having debilitating symptoms, but experiences are also quite variable, with around 20% having very few symptoms. And these symptoms can manifest in many ways, but they're usually viewed as being either psychological, somatic, so to do with the body, or vasomotor symptoms. And while this is a somewhat under-researched topic, autistic people have previously reported that these menopause-related symptoms to be particularly difficult. And there's a lot of really great qualitative research that Christine Jenkins has been involved in, and Rachel Mosley and lots of other people. So if you're interested in this area, definitely have a look at some of their work. But in this particular study with my colleague, Professor Rebecca Charlton, we set out to examine these experiences in our sample of autistic adults in midlife and old age. The general pattern of results were that the autistic participants reported more psychological and somatic symptoms of menopause than the non-autistic comparisons, but we found similar scores for both groups in the vasomotor symptom scale. There's quite a lot of information on the screen at the moment, but the key takeaway message is that autistic people appear to have menopause-related symptoms that are high and stay elevated even when postmenopausal compared to the non-autistic group. And when thinking about why this might be the case, the menopausal transition may amplify existing problems that the autistic people are experiencing, causing their existing psychological and somatic difficulties to increase. But we really need more longitudinal work to understand this better, though. So the big takeaway is that autistic people may experience an increase in their psychological and physical complaints during menopause, which may result in them requiring additional help and support throughout the menopausal transition, as well as afterwards when they are non-menopausal or while they're post-menopausal. Another transition period that can be quite challenging is the process of planning for retirement and actually being retired itself. Retirement occurs when someone opts to leave employment, and this often occurs around the age of 66, although there is some variability from country to country. And while there are some very high percentages out there about unemployment in autistic populations, because of the very high rates of underdiagnosis of autism in adulthood, we have no real sense of how many autistic people there are in employment and how many are planning for retirement and how many are retired. To date, there's been one qualitative study that found that autistic people often have poor retirement experiences, with many retiring earlier and abruptly due to poor health. And these people were retiring well below retirement age. However, in the general population, we also see that early unplanned retirement is also associated with poor outcomes. So with one of my students, Susie, we set out to explore retirement in a sample of around 400 autistic adults. And in our mixed method study, we found that there were many similarities between our autistic and non-autistic participants. For example, most retired at similar ages and could afford, the essentials that they needed. We also found that those planning for retirement had similar hopes that it would give them more time for pursuing interests and leisure activities. And those retired also expressed that it was simply a new pace of life that they really enjoyed. However, we did find some differences. Autistic people often had less concrete plans for retirement, likely due to having less stable employment prior to retiring. As a result of this, they also often had less state-funded support options available to them, like the UK state pension. And this requires a certain number of years of minimum tax payments to become eligible for. Autistic people also reported being less able to afford sort of luxury expenses. And finally, autistic people also raised concerns about becoming isolated without their employment-related social contacts. So overall, autistic people might have similar retirement outcomes, but they will likely benefit from additional help and support with the planning process and with the adjustment process into retired life. Okay, next I'll talk a little bit about some social problems and experiences. And this work was led by one of my former students, Emily Ledecky. Um, we often find that social isolation and feelings of loneliness are common in autistic populations throughout childhood and young adulthood. However, few studies have examined whether middle-aged and older autistic people are at an increased risk of these experiences. Also, social isolation and loneliness are known to be more common in older age in the general population. And isolation and loneliness can be key risk factors for poor mental health and things like suicidality as well. So in our sample of middle-aged and older autistic adults, Emily found that across a range of different social experiences, that autistic people were more likely to have smaller social networks that they see regularly, that they can approach for help and support, and that they have sort of deep and confiding relationships with. And when thinking about the number of people who have no contact with family or friends, around 20% of the autistic people in midlife and older age in our study were considered to be socially isolated. And this was compared to around 5% in the non-autistic comparison group. And another one of my former students decided to dig into some of the potential mechanisms for this. And Radvile found that those with high autistic traits also had very high rates of isolation and loneliness. And she conducted a path analysis and found that once you account for a range of risk factors for isolation and loneliness, a direct relationship between autistic traits and social problems remained. So this suggests that autistic people might be predisposed to these experiences. And Radvile further tested this in our autistic trait sample And she found that different autistic traits and characteristics were associated with isolation and with loneliness. And this sort of knowledge might be quite helpful when supporting autistic people who are experiencing these social problems. Another student, Gloria Lowe, also found that theory of mind partially mediated the relationship between autistic traits and social isolation. And this provides some support for the double empathy theory, where two minds that aren't in alignment often have poor communication. And in this case, it could result in autistic people experiencing more barriers to making and maintaining friendships that could leave them susceptible for isolation. And again, knowledge of these potential mechanisms could be quite helpful for supporting autistic people and preventing them from becoming isolated. To wrap up this section, I want to highlight another study by one of my other students, Hannah Muse. Hannah found that being well connected to friends and family has a protective effect on mental health and quality of life, with people who are well connected to others having fewer symptoms of poor mental health and having good quality of life. So, addressing social isolation and loneliness may be particularly impactful for older autistic people, and it really should be a priority when supporting autistic people to flourish. Okay, so next I'm going to move on to talk a little bit about periods of crisis. This might be a sensitive topic for some, and if that's the case for you, I would encourage you to step away or mute for a few moments, just to make sure that you're not listening to anything that you don't want to hear. Okay. So suicide is one of the leading causes of premature death in autistic populations, but few studies have specifically focused on autistic or high autistic trait people in midlife and older age. In the general population, older age is often a risk factor for suicide. And one of my former students, Sophie Roper, recently examined the rates of suicidal ideation, non-suicidal self-harm, and suicidal self-harm in our sample of middle-aged and older autistic adults. We found that suicidal ideation, which are thoughts of death and dying, were very common in the autistic group. We also found deliberate self-harm to be common as well. And finally, Sophie found that around 20% of our sample had self-harmed with the intention of suicide, which was about 4 times higher than the non-autistic comparison group. And these findings replicate our previous work using our high autistic trait sample as well. I think it's really important to note in both of these studies, though, that these are self-reported rates of living people. So we can't take into consideration those who have died from suicide in this study. One of my other students, Ellie, conducted path analysis between autistic traits and suicidal ideation and harm. And while the model started with a significant direct association between autistic traits and suicidality, importantly, we found that once you account for poor mental health and social problems, these direct associations are no longer statistically significant. So this really highlights how important it is for autistic people to have their mental health and social problems addressed to prevent them from reaching periods of crisis. Okay, to finish up, I want to talk a little bit about some lived experience insights from some of our qualitative studies. There are a lot of really great qualitative studies out there featuring the voices of autistic older people. And this study was completed a few years ago by two of my former students, and involved conducting in-depth interviews with 15 autistic adults aged 50 to 78 years old. Also importantly, this was steered by a group of middle-aged and older autistic people. So we really made sure to sort of focus on the topics that were important to people. So when asked about how their cognition had changed, an autistic woman in her 50s told us that my memory is getting worse. I forget names more than before, lose my train of thought mid-sentence, take longer to finish what I'm saying, and sometimes struggle to find the word I'm looking for. And many other autistic participants express similar sentiments in their interviews. And these points highlight that middle-aged and older autistic people often have concerns about their cognitive abilities as they age. And it also highlights that we may encounter people with these sort of older age cognitive profiles at younger ages that I discussed earlier in my talk. When asked about health, an autistic woman in her late 50s told us, all the different physical and psychological things combined to close down my life. I do fewer things. I stay close to home. And when asked about sleep, an autistic man in his mid-70s told us, my sleep has gotten shorter and I've been waking earlier. I can't really pinpoint when that started changing though. I've always had quite broken up sleep, but it's definitely getting worse as I get older. And again, similar sentiments were shared by several of the participants in this study. And these quotes help to contextualize some of the previous points raised about health can be complex in autistic populations in midlife and older age, and that sleep problems may become more impactful as people get older. When asked about coping with change, an autistic man in his late 70s told us, I don't really know how well I cope with change, if I'm being honest. Things tend to happen, but I'm not sure how good or bad I actually cope with it. I really dislike change. And an autistic woman in her mid 60s told us, a parent controlled my life so much it stopped me breaking down. Straight after they died, I had burnout and needed hospitalization. And these quotes highlight that many autistic people struggle with changes to routine, and big changes like bereavement of parents may have a profound impact on autistic people as they get older, especially if their parent plays an important role in their support system. And when asked about their social lives, oh, sorry, this is sensory. When asked about their sensory experiences, again, we had lots of different responses from the participants. One autistic woman in her mid-70s told us that she notices a lot of small noises, which become irritating, and she tends to avoid the school rush. And another autistic woman in her late 50s said that all these things, like noise and crowding, narrow down what I can do, where I can go, or at least limit how long I can do a particular thing for. And this really echoes some of the points raised earlier about how well, not physical, about how sensory barriers can exist that really prevent people from accessing their local communities, and that can have a play a really important role in their poor mental health, but also creating problems with their social experiences as well. And then in terms of social connections, we have an autistic woman in her late 50s who says that her social life is probably as much as I can cope with, but I still get lonely. But another autistic woman in her mid 50s says that she's actually satisfied with her social life, that she's not a social person, so she's happy not to have friends. And I think this really echoes some of the previous work where autistic people really do vary and their preferences vary. And it also puts a spotlight on how these sort of common misconceptions that autistic people aren't social is really quite damaging. But there will be some who aren't overly socially motivated. So it's really important to listen to the person in front of you and to support them with their needs to make sure that their social wants are being met. So that's the end of the research that I wanted to discuss, and I'll wrap up on a few final considerations and conclusions. So most of the research I spoke about today were online studies, and this might be a barrier for many older people to take part in. Our samples are also quite well educated and diagnosed later in life. So again, this might not be broadly representative of the wider autistic population. And we really do need more work that includes those who have co-occurring intellectual disability or learning difficulties in the, from the 1960s to the 1980s, when diagnostic criteria looked very different to what it is today. It's also really important to note that the underdiagnosis problem impacts the generalizability of our research. So we need to consider when research is being conducted and who's taking part in it. And we need to not be afraid of refreshing the work that we're doing as more and more people are being recognized later in life. We also, but I think really importantly, we find that autistic people, whether they have a clinical diagnosis or whether they self-identify as autistic but don't have an autism diagnosis, or whether they have high autistic traits, we often find that they have very similar experiences and profiles. And we've been able to replicate this across many different studies now, with very similar patterns of results being found. And I think really importantly, there are lots of opportunities for targeted interventions to improve the health and well-being of autistic people as they age. So now we're at a point where we have quite a well-rounded evidence base. And from this, we can look at what areas can be addressed to really improve the quality of life of autistic people to support them with flourishing as they age. So that brings me to the end of my talk. I'm really looking forward to the questions and the discussion and hearing from you all. Like most research, it really does take a village, and there are quite a lot of people in mine. Many of their faces are here. So I'd like to thank them and our funders and all of the autistic people who steered and took part in this research. But also, I'd like to thank you all for listening. The final slide is a few resources that might be of interest. So there's a QR code there for a recent narrative review on aging and autism that I wrote. I've also included my Google Scholar profile that has all of my papers and preprints available as open access. And then the final two are codes for my group's newsletter that we send out about 2 times a year, and also our KCL website if anyone is interested. So thank you very much for listening, and I'm looking forward to the questions.
Thank you so much, Dr. Stewart. Your talk really made me reflect on how much we need more research, awareness, and prevention program to being able to support all the autistic adults and also to prevent and cope with trauma. So,
Mhm.
based on our chat, we have few folks that have shared that they have been diagnosed later in life, 41 and 60. And there's a question regarding racial, ethnic, and cultural challenges and differences. Um, if you can.
Yeah, so I think that that's such an important question, and it's something that is unfortunately really lacking from a lot of the research that we're currently doing. I know that the majority of the people who are taking part in my studies in particular will be white British people. I think it's around 90% or so. And it definitely is something that we need to be more aware of as we're moving forward, as it's very likely that intersectionality will play a really important role in things like accessing healthcare and social experiences and other things. Um, I wish I had more answers that I could give for that, but it's something that we are very aware of, and it's something that we'll hopefully be able to have more data on in the future.
Then we have a person asking, do menstrual cycle take place regular in autistic girl child?
Sorry, I missed that.
Sorry. Do menstrual cycle take place regularly in autistic child or girls?
Um, this isn't an area that I specialize in, being a slightly more sort of older age research. I do know that from some of my colleagues' work that there are often differences or sort of subtle differences in the sort of regularity and also having more sort of disrupted or more sort of sensitive experiences of menstruation and things like that. Um, as a slightly more older age researcher, it's not an area that I'm super familiar with, though, but I'm happy to find some resources and point you towards that if helpful.
And we have a person sharing that they have been a poor test taker, whether cognitive, academic, as a major source of anxiety. Anxiety.
Yeah.
Karen,
Oh,
if you want to ask a
Oh,
question.
no, no, no. I'm just, please answer the question first. So I guess the question is whether or not anxiety interacts with test taking. And
I'm yeah, no, I'm definitely sure it does, and I think if you put anyone in a situation where they are completing a standardized neuropsych assessment, it's going to be something that they don't do every day and can be quite, nerve-wracking, and that will impact people's performance. And I think that likely will play a role in these experiences. Um, I know that from Hilda's work, it's conducted in the clinic and it's done in a very supportive way. From my studies that use these sort of online platforms, they are sort of introduced to the different cognitive tasks. They have opportunities to familiarize themselves. So hopefully that will help sort of parse out some of these sort of anxiety related issues. But I think that's just part of being human, that anyone undergoing a neuropsych assessment will experience some anxiety.
for sure. So thank you. And we will have time for one or two other questions. I have a question too. My question is, and first of all, really appreciate the breadth of information and the way your team has sort of covered very important dimensions of the aging process. So that was wonderful. I talked with you very, very briefly at the beginning regarding people who have intellectual disabilities. And it sounds like your sample is a higher educated sample, so that may not be represented. Are you familiar with research? Do you have some theories, if you were to theorize on how intellectual disabilities might interact with these variables? Do you have some ideas about what that might look like?
So there's very little research out there on autism, well, autistic people with intellectual disabilities and aging. We can obviously look at the wider sort of intellectual disability aging research, and obviously in these populations we do see that outcomes often are poorer than the general population. There are some really wonderful longitudinal cohorts so for example, the Maudsley cohort, who were first diagnosed in childhood in I think the 1970s and 80s by Michael Rutter and Pat Howland. So they're now in midlife and older age, and we're hoping to be able to recontact these people to be able to look at what their life experiences are and try to take a slightly more holistic, sort of bigger picture take on them. So hopefully in a couple of years, I might be able to come back and tell you about some of that work.
Well, we'll
Um,
we'll
but
certainly have you back for that.
I think the aging research in general is often dominated by those who are perhaps more generally well than the wider population that they represent. And I suppose the concerning thing is we're still seeing very concerning patterns of negative life experiences, suicidality, social problems, which I think really puts a spotlight on people want to share their experiences and they want this information to improve the services and support that they're accessing. So I think that's kind of it's going a long way to do that, but it's still very much in its infancy compared to other age research.
And I couldn't help but also think about the interaction of social isolation and loneliness when you add in intellectual disabilities, because individuals with intellectual disabilities are at risk for much smaller social networks to start with and are heavily reliant on family members. And then I wondered what that might look like as that group ages.
Yeah, it's definitely of concern, especially if a parent is perhaps a primary supporter or kind of a key person within their network. That as the person themselves are getting older, their parents are also getting older, and the reality is that they will experience bereavement at some point in their lives, and bereavement for anyone is a very difficult thing. But if that one person is perhaps their sole sort of anchor point, as the person in the qualitative study said, it helped hold them together. If they lose that, the person in their lives who's providing that support, it could have really profound effects on them as they're getting older.
Thank you.
But I think that's something that we need to be aware of, and making sure that people have a wider network.
Thank you.
We have another question. The research suggests that masking reduces stops working during menopause. Do autistic men also show reduced masking of autistic traits with age?
I don't actually think it's been studied in the same way that masking has been in autistic women. I know that a lot of people say that during the menopausal transition, particularly sort of in perimenopause into menopause, that they often find that it's harder to mask, and that's often the time when they are identified as or recognized as being autistic. But I'm not aware of any work that is sort of looking at that. We don't have measures of camouflaging in our main sample, but we do have it in some of our smaller samples. So it might be something that I can go away and have a look at and see if there's some work that we can be doing there.
We have another question that I think you already answered in part. Do we have information on long-term outcome for people with more severe or profound autism?
Unfortunately, the answer is no, at least not that I'm aware of. It is something that we're very aware of and that we are looking to address hopefully in the near future. But predominantly, most of our samples will be people who are late diagnosed um, and often don't have co-occurring intellectual disabilities. We do know, though, from some sort of healthcare registers and things like that, that we do see some higher rates of certain health conditions. So things like epilepsy and other conditions, and these other conditions can increase the likelihood